I've been asked to talk about a specific subsector. I'm going to be talking about the healthcare system in the U.S., in particular Obamacare. In the next 15 minutes, what I'm going to be doing is talking about one chapter in this book which will tell you everything you possibly want to know about the economic determinants of health in the United States as well as the healthcare system. Sorry. Question, fill in. Who do you think said this? I see no reason why the United States of America, the wealthiest country in the history of the world, spending 14% of its GNP on healthcare, cannot provide basic health insurance to everybody. And that's what Jim is talking about when he says everybody, nobody out. A single-payer healthcare plan, a universal healthcare plan. That's what I'd like to see. But as you all know, we may not get there immediately. Because first we have to take back the White House. We're not going to take, then we have to take back the Senate. We got to take back the House. Who do you think said that? Barack Obama. By 2008, Senate and House were Democratic and Obama was president.
Yeah.
The fact that President Obama chose to reduce the number of uninsured through the complicated, privately led Affordable Health Care Act, rather than a single-payer Canadian-style public system, reflects a defeat, I would argue, at the hands of the medical industrial complex. Despite over a century of political struggle, the United States is the only high-income country that does not provide universal health insurance to its population. It's critical to point out, however, that not all capitalist nations have the same class and power relations, and therefore we should expect them to have very different health outcomes and qualitatively different healthcare systems. The United States, by far the most expensive healthcare system in the world, I'll get back to that in a moment, the worst health indicators among wealthy industrialized nations by all measures. U.S. life expectancy, according to the 2010 United Nations Human Development Index, places it behind 28 other countries, following Greece and Liechtenstein, just above Costa Rica. Portugal and Cuba, in terms of mortality rates from children under 5, it ranks 46th, just behind the United Arab Emirates and above Chile. These results are not because of underfunding the United States healthcare system. In addition to delivering poor health outcomes, U.S. healthcare is by far the most expensive, more than any other country. In 2014, the U.S. healthcare spending spent a whopping $3.1 trillion. Really, what we need to think about is it spent about 17.7% of GDP in that year. The next most expensive country spent 40 to 50% less. The OECD spends an average of 9%, so the Americans are spending double for some of the worst health outcomes. I have to say, as a sort of background very briefly, which I'll come back to even more briefly later on, this, of course, our health outcomes have very little to do with our health system in terms of mortality. The economic determinants of health are much more powerful forces determining why the Americans have such poor health outcomes. It is difficult to speak of a healthcare system in the United States even after the passage of the major health reform in 2010, the Patent Protection Affordable Health Act, known as Obamacare. The U.S. has the most expensive, bureaucratic, and equitable health system. While it delivers some of the most technologically advanced medicine and is a medical research leader, it ranks last out of 11th wealthy countries in terms of mortality amenable to medical care, including infant mortality and life expectancy at the age of 60. Spends a lot more and does a lot worse in just about every measure you can come up with. Although 17 million people have gained coverage under Obamacare, we give them credit for that, since 2014, nearly 30 million U.S. adults have no health insurance and 31 million more are underinsured. And once again, this is the only industrialized country that you can come up with numbers like that. The specific evolution of U.S. healthcare has shaped these social conditions, and the healthcare system has evolved to deal with them. If class and power are the two most important determinants of everyday life in the United States, it follows that improving health in the U.S. will require a change in the system of power and in terms of conditions in which people live and work, as well as a restructured healthcare system. So why do we have the most expensive, least efficient, most inequitable healthcare system in the U.S.? And our simple answer in our book is the medical industrial complex. Medical industrial complex in the United States has more power than it does in any other industrialized country. And of course, we also have the weakest unions, and we argue there's a strong correlation there. For those of you who aren't familiar, the medical industrial complex, like the military industrial complex, is a profitable link between doctors, hospitals, and medical schools, insurance companies, drug manufacturers, and medical equipment suppliers, and the state. A revolving door between high-level government positions and industry leaders. Billy Tolson, we've got lots of illustrations of this, case studies, spent 25 years in the House of Representatives. Among his accomplishments was to champion the 2003 Medical Modernization Act that guaranteed large overpayments for private insurers and prevented Medicare from using its bargaining power to lower drug prices. Is example after example of that, what we would call the medical military industrial complex, and many others. During this period of time in neoliberalism, when there was any attempt to reform the healthcare system, the insurance industries tens of millions of dollars with advertising. Harry and Louise, two burdened everyday suburbanites, lamented the state of hypothetical future government health program run by bureaucrats with the tagline, "When they choose, we lose." And you know what we heard constantly during the Obamacare debates was, in Canada, there are death panels. And so there's full of these private sector, for-profit companies attempting to character assassinate any other kind of single-payer universal program. I live in Canada. I'm a health economist in Canada. I haven't seen any signs of any death panels. In fact, of course, we have much fewer people dying from lack of access to health care than the United States does. When Michael Moore did his film, there was a character assassination of him by various health insurance. What about health insurance? What about the healthcare system in the United States? Well, when I teach this class, I talk about three criteria: efficiency, effectiveness, and access. And what we know about for-profit medicine is that it is more expensive, consistently. And one of the more interesting things of quasi-experiments in the United States, you can take two areas that have gone for-profit and then another area that remains not-for-profit. And holding the case mix of the population constant, then we can look at what happens to the relative costs of the two. And we discovered consistently throughout the United States that the for-profit sector is always more expensive, holding case mix constant, the characteristics of the patients. In terms of effectiveness, the death rate, the mortality rate in for-profit institutions in the United States are higher than in not-for-profit institutions. About 2 to 3% higher mortality rate across the board, whether you're talking about heart disease or dialysis treatments, etc. And then one of the more interesting things, of course, the world of consumer sovereignty in the United States. When we actually ask consumers where they prefer to be, and when they do consumer interviews, they prefer the not-for-profit sector. The not-for-profit sector, they find, even though there's no clinical outcomes measured there, talking about consumer satisfaction, they prefer it. So in terms of efficiency, not-for-profit. Efficacy, not-for-profit. And of course, access. Obviously, in universal health care programs, everyone's covered for everything. We're in the United States, of course, people aren't waiting on long lines. We could talk about Canada later on if you want to, and other places, because they can't get on a line. If you don't have health insurance, you're dying or you're suffering at home. That's the difference. Much time go ahead, Al?
You got 8 minutes, 7.5 minutes.
I won't even take that one. Okay. From the Boston School of Public Health, estimated that 1/2 of all health spending in the United States goes to clinical administrative waste, excess prices, and theft. And so this is a system that is deeply inefficient and also corrupt. I'm not going to spend the time talking about the number of for-profit corporations in the United States that have paid the governments hundreds of billions and billions of dollars because of their corruption. This is a unique system. It doesn't mean that other systems don't have corruption. It doesn't mean there aren't huge inefficiencies. In Canada, where I come from, the number one reason why healthcare costs have grown to 10 to 11% of GDP, significantly below the US, is because they haven't brought under control the pharmaceutical industry as they have hospitals and doctors. So if you look over the trend lines over time, hospitals and physician costs in the United States are actually are constant over a 30-year period. What's gone up is the pharmaceutical industry, which they decided in their infinite wisdom, and there's a struggle for that right now, to bring the pharmaceutical industry under its control. If they did that, then of course the Canadian 11% of GDP would theoretically be much lower. Profits of the medical industrial complex. Out of 51 industry analyzed in the Fortune 500, 3 of the 15 most profitable industries belong to the medical industrial complex. The drug industry is very profitable. The drug companies consistently have profits 3 to 5 times greater than most Fortune 500 companies. This is a system, a corrupt system of evergreen drugs, I can explain that later on, of patent rights, corrupt patent legislation, all of which allows them to charge the highest prices in the United States for drugs in the world, and the drugs are no different than they are anywhere else. Canada also has a corrupt system, it's 4th. And so we can work our way down the list, but you're holding constant the drug, and then you compare its price across the world, never mind the fact that a lot of these drugs are essentially no more effective than their much cheaper generic alternatives. We can talk about the drug industry in the neoliberal period as well. Doctors, one of the things you hear about the United States is one of the reasons you're not going to be able to get your healthcare costs down is because doctors are so much more expensive, and they are more expensive. But the typical doctor essentially induces about 10 times as much healthcare costs as they get paid. So a doctor that gets paid $160,000 a year is essentially in a hospital for-profit, and there's a difference of whether for-profit or in a fee-for-service versus a non-fee-for-service hospital. They're inducing 10 times as much healthcare costs because they are the gatekeepers. I won't take that long. And so while the doctors do make a lot of money, they become increasingly proletarianized in the United States. They're not nearly as independent as they were in other countries, and they once were. They now work for HMOs. They work for-profit hospitals. They're often on salary, or unfortunately, often they're getting a percentage of the take. So every dollar the physician earns for themselves is only a fraction of the effect of overall demand. I would talk about the supply-induced demand in healthcare if we had more time, but I won't. A survey of the chief financial officers by the Healthcare Financial Management Association found that physicians generated an average of $1.4 million per year for their hospitals, as I said, about 1/10 of how much they're making. Obamacare, I know I haven't got much time. The starting assumption of the Obama administration was that universal coverage would never be achieved if it was opposed by the political and financial clowns of the medical industrial complex. So a proposal had to be crafted which the medical industrial complex would benefit. And that's exactly what it's done. I've got lots of numbers on how much the U.S. Chamber of Commerce put into this, the hospital associations, the insurance companies, how much money they put into campaign contributions, a kind of a crude model of how you get political outcomes. But they put tens of millions into those lobbying activities. And so the outcome of all of that, of course, is that there is public opinion in the United States that is, I guess there's a word, there's a term that's been used, they're confused. They think that, in places like Canada and other countries, there are death squads. People are going to suffer more. There's going to be long lines. For the vast majority of the average American, they would dramatically be improved if they worked under a single-payer Canadian system or other systems around the world. At the apex of 2009, for every single member of the House of Senate, there were 6 health care lobbyists, some 3,300 in all. The 25 highest spending organizations in healthcare lobbying spent a combined $288 million in 2009. I'm not going to sort of go through the rest of the list here. The medical industrial complex also financed advertisements that influenced public health. Pharma spent $100 million. Simultaneous highlights how Obama chose to craft reform that would benefit the medical industrial complex and how its influence dramatically reduced the likelihood of any but the most marginal changes to the U.S. healthcare system. The single largest difference in healthcare expenditures in the United States from other countries is that it's run through private insurance. In Canada, it's run through a state bureaucracy. We all know how inefficient state bureaucracies are. Well, the U.S. private insurance companies spend 3 times as much creating bureaucracy for healthcare, which is money not spent on actual healthcare outcomes, but money spent on overhead costs. So the Americans spend far more than anybody else does. The Massachusetts model, I know I'm running out of time again, which is a sort of forerunner of the Obamacare, done by the same MIT economist. If you look carefully at the Massachusetts plan, you'll see how much more it costs a lot of poor people. You'll see how little access is, and you'll see how little efficiency you get out of it. They did very little to do cost controls. We can talk about cost controls before. My last paragraph. Obama swept to power with the promise of change. Yet the shortcomings of the ACA were the inevitable results of attempting to improve health care coverage without changing the broader class forces that have shaped the U.S. political economy over the last 30 years. A particularly powerful and well-entrenched subsection of the business community has been able to ensure that the genuine dissatisfaction with U.S. health care was channeled into legislation that it found largely unacceptable. One little footnote before I finish. One of the more amazing things is how inefficient the U.S. healthcare system is for the capitalist class as a whole. That's fundamentally critical. So if you're in the tradable goods sector and you're trying to sell cars out of the United States, the typical amount of healthcare costs in a car is $1,500 in the United States. The amount of healthcare costs in a car in Canada is $400. And so there's a fraction of capital because of the overall ideology of neoliberalism that's actually undermining the interests of capital as a whole. In Canada in 2004, when there was talk about U.S. Healthcare reform in Canada, there was a letter written in the Globe and Mail of Canada's New York Times, signed by the three major auto companies, General Motors, Chrysler, and Ford, along with the auto workers, not only calling for sustaining the Canadian health single-payer system, but expanding it to cover dentistry, to cover home care, and to cover pharmaceuticals. Because in this case, like as David might tell us, in the pre-neoliberal period, the unions, and because they're more powerful in Canada, and the business class actually had some common interests. In the United States, of course, we have a tradable good problem, partly because of our healthcare system. The less politically powerful, broader populace fared less well. Talking about the U.S. through Obamacare, healthcare coverage was expanded under the ACA, but only by relying on increasingly expensive private plans. The unsatisfying compromise that was the ACA was further proof that the current alignment of U.S. political and economic forces creates huge obstacles for any progressive legislation. No sweeping progressive legislation has been passed for over 3 decades since neoliberalism, and the ACA certainly did not reverse that trend. It is very much part of the neoliberal period of regression, although it did expand some health care, but it only because it served profits of the medical industrial complex. Thank you.